Shake up at the CDC. Tonight we are unraveling this massive overhaul of the public health agency that its own director now says failed during the COVID-19 pandemic. The goal now to re-earn the public's trust as a source of accurate health information. John Shearing joining us live at the CDC's headquarters in Atlanta. John?
The CDC director, just a year and a half on the job so far, telling all 11,000 employees in Atlanta and around the world, enough is enough. We have to do better. Here's the plan. We start now. CDC Director Dr. Rochelle Walensky now says, in effect, the CDC had basically one job during the pandemic and bungled it. Quote, "In our big moments, our performance did not reliably meet expectations, too often confusing the public with conflicting guidance on how to avoid and survive COVID." So she is ordering a top-to-bottom, inside-out overhaul at the CDC so the public will get accurate health information from the CDC during emergencies and immediately.
Also, when we have data, sharing it as quickly as we can with the public, and also making sure our staff are prepared and ready for a response.
I asked CDC Acting Deputy Director Dr. Deb Oury, why now?
I think it's really just the lessons we've learned during COVID, constantly wanting to do better and knowing we needed to be responsive to the public. So now was the time.
The shakeup just announced, the result of a months-long investigation that Dr. Walensky ordered into the CDC's massive bureaucracy.
The modernization really needs to happen, and there is an urgency behind how she's describing what's going to happen and how things will play out.
Public health physician Dr. Julie Morita with the Robert Wood Johnson Foundation says that now, with the pandemic grinding on, and with monkeypox and even polio again, the CDC has to get it right once and for all.
These public health emergencies aren't going away, and so we really need a strong, fast, transparent CDC, and that's what this plan really focuses on doing, is really making CDC stronger and better overall.
Dr. Walensky is also creating an Office of Equity to make sure that the CDC staff is fully diverse and to make sure every segment of the population can receive CDC services.